Hello, this is Kelly Stahlman. Welcome to Parent of Colorado Facebook Live. How are you all today? Couple of things. We're here today to talk about how families and children with disabilities, adults with disabilities, whether we're parents or consumers or self-advocates, how can we get involved in the healthcare conversation? How can we make a difference in our lives and the lives of the people that we love? I would also offer that this is true if you have elderly parents or you yourselves are becoming elderly. I'm officially a member of AARP, so I fit that demographic. So where do we start? First, this is the 2-week congressional recess. So all 9 of our congressional delegates, our 2 state senators, which cover the entire state, each one covers the entire state, and our 7 congressional delegates are here in Colorado for the next 2 weeks talking to constituents. And what can we do now that they're home, now that they're here and ready to rock and roll? Well, apparently the kitty is coming to say hello. So let's talk what you can do. There are many people who feel that their voice won't be heard and that their emails or phone calls just don't matter. How much can it really matter in a 30-second phone call what you say or do? And I would, not only me, but all of the healthcare advocates across the country are saying that it does matter, that you can make an enormous difference just by picking up the phone and saying, I care. So phone or email, do it today, do it every day, do it twice a week, do it once a week, do it once a month. Pick up the phone and email and tell your story. There's a quote that Lisa Franklin has, who's on this, who's making comments on the scroll below. So check out the comments. And it's something to the effect, and I don't have the quote, I hate it when I do this, but data matters. Data may change minds, but stories change hearts. And I think we kind of saw that last week. It was the photographs of children dying in Syria that caused President Trump to take action. Regardless of your political beliefs, that is the talk track. That is what is being reported and what he said in his news conference. That the individual stories of the kids on the ground were a huge deciding factor in President Trump's action in Syria. Likewise, our stories of our families in our lives, of our children with disabilities, and I'm not comparing the two, trust me, please don't go there, I almost wish I could take this whole thing back, but our stories can change the minds and hearts of our leaders in Colorado just as much as stories have changed the hearts and minds of the president. So let's backtrack. What do you do and how do you change your story? First, we know that Doug Lamborn is having, let me see what she said. Lisa just posted, oh, it's on here. Lisa, post again. But Doug Lamborn is having some sort of town hall meetings. He's in Congressional District 5 today, tomorrow, and Thursday. Mike Kaufman, Congressman Kaufman, is having a live town hall meeting at the Anschutz campus on this Wednesday night from 6 to 7. Lisa Franklin with Parent to Parent had emailed and said, you know, you're sold out. There's a space limitation. I wish I could go. And she got a call back from one of the interns in Congressional Kaufman's office, and he said, you know, we're getting that a lot. We know we need to have people have more of a chance to hear us and for us to hear them. We're thinking of doing a Facebook Live. So that's exciting. That's very exciting, and that's an easy way to join in. I know that he's had a town hall conference call and a call-in session. I sat in on Senator Gardner's telephone town hall, and he's had 2 of those. I went to Congresswoman DeGette's town hall in January, I believe, or February, and spoke with Congressman Perlmutter when we were back in D.C. a few weeks ago, as well as Congressman Kaufman. Everybody needs to be involved and tell your story. It's easy. Go to the website, get the phone number. Make a quick call, and all you have to say is, hello, my name is Kelly Stahlman. I'm a parent of twins with cerebral palsy. My kids have Medicaid long-term care, not expansion, long-term care, and vote no on Medicaid block grants and per capita caps. I have private health insurance. Please keep the 10 essential health benefits. Please keep guaranteed issue, which is where for us, guaranteed issue is where you can't get denials for pre-existing conditions. And please keep that there's no cap on lifetime limits. Thank you. Click. So there's in private health insurance market, there's no lifetime limit. We want to keep no lifetime limits, keep no denials for pre-existing conditions, also known as guarantee issue, and keep the 10 essential health benefits. For Medicaid, people do not understand the difference between Medicaid and Medicare. They do not understand the difference between long-term care Medicaid and Medicaid expansion. They do not understand what's going on. Just so that you know, Obamacare, also known as the Affordable Care Act, also known as health care reform, was started in Massachusetts by a Republican governor, and what the Republican governor, Mitt Romney, said was, you know, people with low incomes, we understand that you can't pay the full boat. You have to pay for food and shelter before you're going to buy health care, health insurance. We get that. But please take personal responsibility. Please purchase health insurance, and we will help decide what level you pay based on your income. So it's, you know, pay as you are able, and we will match you. We will help contribute, but come to the table, come to the party. There's no such thing as a free lunch. Take personal responsibility, buy health insurance, and that way we can pay the providers in the hospitals and keep the healthcare system whole. It also says to younger, healthier people, please pay your part. It is a responsibility of every American to participate in healthcare so that when you need the emergency room is there for you, whether you live in a metro area or a rural area. And one of the big issues is that rural hospitals are at risk of closing. 50% of disability and accidents in the rural community are work-related injuries, and they many require emergency medical treatment. These rural hospitals and rural healthcare facilities are vital to rural communities. So, Mitt Romney said, come to the table. Those that are low income, maintain your personal responsibility. Pay what you are able, and there will be a sliding fee scale. You young invincibles who aren't yet sick, you may have a car crash. You may have a softball accident. You may break your arm jumping on a trampoline or doing your skateboarding or your rollerblading or your longboarding or skiing or kayaking or river rafting. Whatever you're doing, you may need health care. Therefore, pay for insurance and come into the market and participate. And that is how healthcare reform began. It also began because the research showed that people weren't seeking health care. If you go back to the 90s, health insurance paid for 90% of every dollar that was spent in health care. Today, it's 60%. So the cost sharing increased. Not only did the premiums go up, but the co-pays went up, and the co-insurance and the deductibles. So even for those of us who have private health insurance in the major medical market, employer-based market, our healthcare cost sharing went up. At the same time that went up, all of a sudden the individuals or the small business owners said, we can't afford this. We can't afford 60%, 40% of the bill. So we can't afford health insurance. We're just not going to get any. And the Young Invincibles said, kind of screw you, I'm healthy, I don't need health insurance. And then that all was causing people who were getting sick to go down, to spend their assets down to poverty. And now they needed, especially if you had disabilities, now you needed to be really poor, really, really poor. Lose your house, lose your car, lose your livelihood, lose your disposable income, lose what you could pay for, and live in poverty and have, in order to access Medicaid and stay alive. Nationwide, in fact, I had the opportunity to go to the National Association of Insurance Commissioners this weekend. Their conference was here in Denver, and I only went to one session, and it was on Medicaid. But they talked about the 80-20 rule. If you've ever been in sales and marketing, and I used to work for a Fortune 500 company, and 80% of your business comes from 20% of your counts. Think of the big box stores, the Walmart and Home Depot and Sears and Penny's and Macy's. The big box, the larger retail stores have 80% of the business, and the smaller stores account for 20%. Not entirely true, but you get the point. It was an old sales maxim. 80% of your business comes from 20% of your accounts. 80% of Medicaid comes from long-term care clients. And actually, it's 2/3 to 1/3. Nationally, 1/3 of Medicaid clients on long-term care account for 2/3 of the nationwide costs. It's 67%. And it's because the long-term care insurance market is losing money, and many people spend down their assets, and now they're impoverished, and now they go into long-term care facilities, and you go through your assets very quickly, and now you're on Medicaid.